as you're sort of driving that deep change, right? As you're focusing on your vertical, you do have to stay connected, I have to imagine, to the consortiums of organizations, the people who are burdened by the weight of their status quo. How do you, from the outside, work to bring them along for the ride? And how well does that work?
I think the best thing that we can do is help people dream as in terms of Gotcare. That's the best role we can play when we collaborate with our partners, is that we essentially give them a almost like a sandbox to play within. And we're not too small anymore. We launched in 2018. We've now serviced almost 4,000 patients now. So not tiny either, but definitely not medium or big yet.
Yeah. Well, you've got room to grow, but you have scaled. And so let's move into talking a little bit more about kind of the potential to scale this transformation and new model of home care. So I think, first, what has the scaling that you've done across Canada been like so far? Can you tell us about any challenges you faced, maybe especially in some remote communities? I know you're really proud of some of the work that you've done there.
Yeah. So we actually started our business in insurance funded care and not publicly funded care. Actually, our journey in public funded care is only in the last year. It's very recent
Oh,
for us.
wow.
But we started our journey in insurance funded care because, bluntly, it was found it to be a little easier. And so we focus specifically on complex claims, recovery in the home due to complex claims. And we've been able to now scale to 38 insurers across the country, servicing everywhere except for Quebec and the true north. But yeah, and what we've been able to demonstrate is that on average, we're able to lower claim utilization rates by at least 30%. And that's massive, right? Like that's like a very tangible thing. And when we look at, what are the main contributors to that cost containment, it comes down to time to care. So reducing time to care, which means reducing future complications. And it also comes down to client self-management. So empowering clients to be more in control of their care, and effectively be a stronger advocate of the care, and take more responsibility over their own care as well. Focusing on this more goal-oriented way of addressing care needs, as opposed to a more prescriptive-oriented way of addressing care needs. And it's this combination of the two that has allowed for us to achieve this type of cost containment. Of course, we've learned, there are certain cohorts of clients that are not well suited for our model of care, and that's fine.
Yeah.
And so what we've now started looking at doing is to look at, what are some ways that we can apply some of what we've learned in insurance funded care to our publicly funded care system, to hopefully be able to provide some of that there too, pertaining to time to care, and as well as empowering clients as well.
Well, and so I am a recent immigrant to Canada. I'm an American. I'm still honestly learning the basics of the Canadian healthcare system. But am I right in understanding that from sort of a market opportunity perspective, even though it might be pretty difficult to navigate, that's a pretty dramatic expansion that you're chasing as you look to publicly funded care?
Yeah, I mean, I think to be a healthcare entrepreneur looking to create change in publicly funded care, I think you need to have a long runway and a lot of patience.
Yeah.
So the good news is that because we have a core group of customers that are insurers, and we have our that part of the business is going swimmingly well and doing its thing, we're able to. The way we see it is we're able to really invest in this, to see what we can do. And we're able to do it with less attachment to an outcome, because we're not you're not dependent on it to keep the lights on. And I would caution to health entrepreneurs who do depend on the public sector to to keep the lights on, because that is very challenging. It is, I won't lie, it is very, it takes time and patience and a lot of stakeholdering to get it done.
Yeah.
Yeah.
And I think that stakeholder management and patience, I think, feels like a recurring theme on this podcast for folks that are trying to, institute change and innovation at any really large organization, public or private. And I think that's such an important reminder for entrepreneurs. But you are in growth mode. You have a lot of opportunity ahead of you. Are you looking beyond the borders of Canada? Do you see this model, whether implemented by Gotcare or others, as being applicable elsewhere? Fragmented systems like the US, more unified systems like we see in some markets overseas?
Yeah, 100%. We feel that there's some more similar health systems to ours, like in Canada, like the UK, Australia, where it's a much more direct one-to-one plug. Whereas, other markets like the US, definitely on our radar, but requires a bit more of an adaptation. But yeah, for sure. I think in general, right? Like there's just, we're all looking for ways where we can serve more people with a smaller, dollar pie to deal with. And at the same time, we're trying to add convenience by increasing the type of service we can deliver in the home setting. So just we're all going to get there. It'll get there. It's all going to get there.
It's a never-ending journey. And again, like I say that a little glibly, but it is, right? Like there's always more, a better layer of experience, a better layer of efficiency, and kind of an iterative cycle. And somebody has to push that forward, right?
Totally.
So we've talked a lot about you as a CEO and as a leader and founder and entrepreneur. But to this point of, managing stakeholders, driving cultural change, advocating on behalf of others, you also do a lot of work in the community. You've been recognized for leadership as a member of Ontario's Task Force on Women and Economy, I understand. You're on the advisory board of Corrales, focusing on advancing women and non-binary-led entrepreneurship. Tell me a little bit about this part of your life, and how does it relate to your journey as an entrepreneur?
Yeah, I mean, I think it's just more of like who I am. It's more of just who I am as a person.
Just gonna get out there and push.
And I think this is why I started with, like, I just identify as a social entrepreneur more than a more classic growth entrepreneur, so to speak. And yeah, it just it's like I'll joke. My friends call me a Care Bear. It's just like I'm like walking around the world. I got my little Chenny Care Bear icon, and I'm like, I care. Anyway, so yeah, no, but yeah, I for me, it's about being in community, really. And what I love about doing this type of work, regardless if it's for my venture or through other organizations that I support as well, it's that we're it's like, I don't know what else to call it other than like a very personal transformation journey, right? Like, it's very much about our work being a vehicle of us getting clearer on who we are as people, and being really brave about the kind of world that we want to see.
Yeah.